JLabs at Washington, D.C., along with John Falchicchio, Deputy Mayor for Planning and Economic Development.
Well, good afternoon, everyone. I'm John Falchicchio, and you're probably wondering, what is the Deputy Mayor for Planning and Economic Development doing on the stage? Well, Sally's going to help me talk to you a little bit about, we heard a lot before on the panel before about how you have to have advocacy, how you have to have interventions. And what we're going to talk a little bit about is innovation and how you take new ways of approaching problems that have been with us for a long time. So Mayor Bowser in 2017 convened with the governors of Maryland and Virginia to go to Toronto, Canada. And one of the stops that we made with Children's National was at JLabs, Johnson & Johnson's innovation incubator. And we went there to see what JLabs is all about and to ultimately try to get a JLabs somewhere in the region. And so we're really excited that in 2019, we were actually able to announce with Mayor Bowser and Children's National that JLabs would be locating right here in DC at the Children's National Innovation Campus at Walter Reed. Now, 2 years later, we're here.
We are open for business.
We're open for business. So I like to say, you may hear me say it often, DC is open, JLabs is open. And so what we wanted to do at DMPED was to work with Johnson & Johnson and Children's National to put together a challenge. We've talked a lot about health disparities today, so how do we actually address health disparities through innovation? So Sally, tell us a little bit about JLabs, and then we'll talk about the Quickfire Challenge.
Yeah, first, and let me thank you for having us here. I think this is an amazing and important summit. We're thrilled to be part of the summit and talk about hard topics like maternal mortality, also some other health issues, which was part of this Quickfire Challenge. But before we talk about the specifics, let me tell you a little bit about Johnson & Johnson Innovation and what we're doing here at Washington, D.C. So as you alluded to in 2019, we announced our partnership with Children's National as launching and anchoring at their new research and innovation campus in Northwest DC. We thought it was incredibly important to be here in Washington, DC, to bring a light to the need for more pediatric innovation, but also this incredible strategic location to incubate companies, to support entrepreneurs and early stage companies. So Johnson & Johnson Innovation, JLabs, is a global healthcare incubator. We launched and opened our 13th here in DC. We opened for business in April this year. And what we do is support early stage companies and entrepreneurs with an incredibly easy turnkey access to wet lab research facilities, medical device innovation labs, and we surround these entrepreneurs and companies within a global ecosystem of support and resources, access to capital. So we are incubating and supporting all over the world over 700 companies working in pharmaceuticals, medical device, and consumer innovation, as well as digital health. And so, as I mentioned, we opened in April. We've started onboarding companies at the new Research Innovation Campus, which is an incredible ecosystem itself. The idea that entrepreneurs and companies can also sit on an innovation campus, work directly with Children's National's research institutes, cross-pollinate, and drive more partnerships.
So taking the concept that we first saw in 2017, 2019 was the announcement, 2021, here we are, you're open. So what can we expect to see a year from now out of the JLabs here in DC?
Yeah, that's a great question. So as we roll companies into JLabs, many are at different stages. We're supporting not only entrepreneurs here that have started their own business within Washington, but also bringing in companies from outside of DC. A great example is a company we are bringing up from Alabama. Actually, they're here. They want to expand and scale their business. They want to reach communities like the district The company's called Acclinate. They're working on driving diversity in clinical trials, and they have a hashtag now included platform, incredibly important. We want to bring in companies to connect with patients and consumers, partner here. So in a year, I will be thriving. You know, we're excited to bring more companies in, support more entrepreneurs, and also be a place where, based on our location, that we can have conversations with individuals that are driving bills and access to capital for entrepreneurs and early stage companies, so that those individuals really understand what it takes to move science and research and technology forward faster.
So there's probably somebody in the audience, whether here at the convention center or watching from home virtually, who has an idea, who's an entrepreneur who wants to help, especially in the area of maternal and infant health. How do they tell JLabs about their thoughts, their ideas, their innovation, and what's the process for them?
It's a great question. Really simple. It's an online application. You can apply to one of our locations here in the district in Washington, D.C., or any of our other locations around the world. Non-confidential information, and we'll start that conversation of really understanding your science and your technology and how we could fit and help you really move it forward.
So I hope that a year from now, somebody who watched this will actually be at JLabs. That's going to be our goal, is to make sure that we keep finding DC entrepreneurs to go to JLabs. Tell us a little bit about the Quickfire Challenge and the winners of the challenge.
You know, this is a great partnership, and you know, I want to ask you in a minute why this Quickfire Health Innovation Quickfire Challenge. What was important to us is to bring a light to socioeconomic health challenges, problems. We need more solutions. We need more technologies to reach more patients and consumers. We took information from the DC Health Report. We looked at some of the problems that are here, but not only here in the district, it's well known and seen in other areas of this country. We thought maternal mortality is incredibly important, and we heard from the panel prior to us the idea that women are dying in this country and having children is a major problem. We know cardiovascular diseases, we need more solutions, and also kidney diseases. So we worked with your office and the mayor's office and wanted to put out that call for applications on new solutions, new science, risky science. That's what we want to do. We want to incubate entrepreneurs that are going to take risks. And many of these entrepreneurs start from a position of seeing the problem. Either it's a problem they've lived themselves, or seeing a scientific problem and that they have a solution for. So we're excited to talk a little bit or showcase some of these companies.
Yeah, so I think for us, and I see Beverly Perry, the mayor's senior advisor, Polly Donaldson, the director of Department of Housing and Community Development, in the front row. They know the mayor is very keen on getting fresh ideas. She always is asking us, what are the fresh ideas? What ideas are you hearing? And for us, actually, how do you make those ideas into an innovation? That's what's so important. And what we were excited about to partner with JLabs is that it actually puts a little bit of structure around taking something from an idea into actually being a company and then successful thereafter. So Mayor Bowser had challenged us years ago and said that if you could swipe right for love, you could look on your phone, you could order food and have it to your doorstep in 20 minutes. You could do all your banking on your phone. Why can't we help address health outcomes and really tackle disparities with technology and with innovation? And so with that challenge, we have reached out to JLabs. We've got some exciting companies that are going to be locating on the Walter Reed campus. So I think it's time to showcase our winners of the Quickfire Challenge.
Yes, and thank you. We're excited to bring these companies forward in partnership with your office and the mayor's office in selecting these awardees. Each awardee will receive $50,000 and as well as 1-year residency at JLabs at Washington, D.C. With that, before I turn it over to a video, I'm excited to announce that the companies May, Mama, Vasculonics, Paradox Immunotherapeutics, and Tiny Cargo are the awards this year. Let's go to a short video.
We created Mama from our shared experience of slipping through the gaps of the maternal mental health. It impacts up to 20% of women and even higher for other populations. Women need to feel safe and trusted, and they need to feel like it's a safe place to get help and to share what they're experiencing.
Our healthcare system is deeply inequitable, and in the maternal health space, it is failing Black mothers.
So that's where May comes in. May is really laser focused on bringing these fragmented pieces of care together in collaboration with payer partners and community partners and governments. We have designed our solution specifically for Black expectant and new moms with the goal of driving positive and more equitable pregnancy outcomes.
Diabetic kidney disease is a huge unmet medical need. It's expected to be 650 million people or more having diabetes by year 2040. Vasculons is pursuing a novel pathway that is very relevant to kidney disease.
Let me tell you a quick story about Anna. Anna and her family suffer from a condition called ALEC2 amyloidosis, a severely underdiagnosed form of kidney disease that may affect 1.6 million Hispanic Americans in their lifetime, which is also one of the highest uninsured patient populations in the US. They've been long considered incurable and without treatment options, but we at Paradox want to change that.
Cardiovascular disease is the #1 rate of mortality in the United States. The current treatments for both of these are either highly invasive, exhibit a lack of efficacy, or most importantly, are out of reach to the very communities which are disproportionately impacted by both cardiovascular and ischemic heart disease. What we aim to do is provide a therapy that is in reach to all of these communities that can be used to reduce comorbidities associated with heart disease.
With our relationships and our experience in the DMV, in particular with marginalized populations, we're really well poised to get started on day one.
The backing of Johnson & Johnson and being given this sandbox of Washington, D.C. With a really critical need to serve families is an amazing opportunity for us and to connect with other innovators and key stakeholders.
Given this existing need, the innovations happening at the community level and at the state and federal level and those incentives coming down the pipe, there's just no better time to forge some of these partnerships than now.
Well, Sally, on behalf of Mayor Bowser, thank you to Johnson & Johnson and to Children's National for partnering with us on this Quickfire Challenge, and we can't wait to be back here next year to hear more about these companies and maybe even our next round of winners.
Thank you so much.
Thank you. Thank you, everyone.